let's just check in with a respiratory specialist, Dr. Nurul. And of course, she will shed more light on this. Doctor, thanks for doing this and joining us on this very important topic. Is it true that vape smokers have a lower risk of being sick or falling ill compared to conventional or traditional cigarette smokers, Doctor?
Yeah, thank you for the invitation. Yeah, so basically, I would say it's not true. Yeah, vape smokers have their own risks, while cigarette smokers have their own risks. Yeah, both are actually dangerous. Yeah, while danger of cigarette smoke have been established for multiple years. Yeah, a lot of research have been done, to confirm the danger of smoking. Then vape is still new, but then so far a lot of research, a lot of findings are actually pointing towards danger from vapor smoking itself. Yeah, so just want to share, recently since September 2019, a surge of lung illness or acute lung injury, we call it e-valley or e-cigarette related vapor associated lung injury, have been described among the US population, and they found the increment of lung inflammation cases, especially among vapors. They found 800 hospitalization due to vape associated lung injury, and out of that 68 deaths were found based on research done by the CDC, Center for Disease Control. So this research is actually confirming the danger of vape associated lung injury. So I would say vaping is not safe. Smoking are also not safe. So as a lung specialist, I've seen a lot of vape related lung diseases. I've seen a lot of smoking related lung diseases, and I would strongly advise our population, our society to stop vaping and stop smoking to ensure lung health among our society.
Doctor, can you share with us also with regards to second-hand smoke? How likely are their chances of being affected by this vaping practice?
So second-hand smoking or second-hand vaping means that the person is not really vaping by himself, but they are actually exposed to vapor. They are also in a dangerous situation actually, because they can develop associated lung injury as well, because vaping is actually a device that produce vape, aerosolized gases from the liquid. So this device is actually producing harmful chemicals, which contain chemicals such as glycerol, propylene glycol, tetrahydrocannabinoid, which is actually a component for marijuana, also nicotine, and also addictive flavoring, such as diethyl. So these components have been identified as a harmful component for the lungs, and these harmful components can also affect second-hand vapor and also second-hand smoker. So as a lung specialist, I've seen a lot of asthmatic patients who develop a severe asthma attack due to exposure to vape, even though they are not vapor by themselves, but they are spouse of the vapor. I have asthmatic patient have to be admitted to ICU, even though she's not a vapor, she's not a smoker, but the spouse is a vapor. So this effect will not only affect the vapor itself, but definitely it will affect the family members of the vapor, the friends, the community, the society. So that's why vape is actually very harmful to the vapor itself, and also to the second-hand vapor and also second-hand smoker. So those are the things that we need to really be concerned about.
And often we also see vaping happening indoors because sort of, the perception is that it doesn't have much smoke and it vaporizes. Therefore, it is perhaps perceived as safer indoors, which of course you've confirmed is wrong. And secondhand smoke does affect people around, as in non-smokers as well. Doc, now, what do we do if one is a non-smoker living or in an enclosed area with a heavy smoker? And also, I guess, furthering that, how can vapers stop their vaping habit?
Yeah, so basically, non-smokers, non-vapers have to take care of their own lungs. Yeah, even though they are not smoking, even though they are not vaping, their lungs are actually at risk. Yeah, if they are constantly, surrounded by vapers and smokers. So they need to, establish a ground rule. Yeah, of living together. Yeah, the rule is that the vapor and the smoker cannot go inside the house. Yeah, if they are vaping, means that whatever vaping, whatever smoking that they want to do, please do it outside of the house. Yeah, it's good if they can change their clothings as well upon entering the house. Yeah, because even though they did not smoke inside the house, but whatever residual substance from smoking, vaping can still, be left on their clothings, which can affect the family members. Yeah. So as a ground rule, yeah, no smoking, no vaping upon entering the house, and to change clothings, yeah, upon entering the house, and make sure the kids and the wives, yeah, are not exposed to these smokes and vapes, yeah, when the vapors and the smokers are around. Yeah.
That's right. Doc, very quickly, under 20 seconds, will a drastic stop from vaping or smoking lead to other complications?
Okay, so some people might develop some withdrawal symptoms, yeah, if let's say they suddenly stop smoking or stop vaping. But some people, they are okay, yeah, they will not develop withdrawal symptoms even though they stop vaping or stop smoking immediately. So it really differs from person to person, yeah. But I've seen a lot of cases, yeah, when they are dealing with a life-death situation, yeah, especially patient who develop sudden asthmatic attack, yeah, or sudden pneumothorax, sudden lung injury after smoking or after vaping, and and they have realized that upon vaping, upon smoking, they will have difficulty breathing, they feel like they're going to die soon, then they can just stop smoking, stop vaping at that point of time. So basically,
Doc, we
really
want to thank you very much for weighing in and highlighting as well this issue, taking us through the dangers of smoking and vaping all together, and you've confirmed that it's not safe for the smoker, the vapor, and for family around as well. I'm off to a quick